The Braid trial is a trial of offering women with dense background patterns on a screening mammogram additional mammographic screening. You may be aware that the breast tissue is made up of fatty elements and denser glandular elements, and about 10% of the population have very dense breasts. And this is a problem sometimes because it makes it harder to find cancers on the mammogram, but also these women are at slightly increased risk of getting breast cancer as well. And what we want to know from the Braid study is, could some additional screening tests actually improve cancer detection in this group of women? Additional tests that are being offered as part of this national study are an automated whole breast ultrasound, or a contrast-enhanced MRI examination, or contrast-enhanced mammography. And in Nottingham, we're offering contrast-enhanced mammography to women who take part in this study. Contrast-enhanced mammography involves an injection of a standard X-ray contrast agent, which is used for CT examinations and angiogram studies throughout the NHS and throughout the world, actually. But we combine this with a standard mammogram. So it's standard mammogram images, but you have an injection of the contrast agent first. And we think that it might find additional cancers in women with this dense background pattern. Only a very small number of women who we offer additional screening to will have a cancer. It's only a very, very tiny number because these women have already had a normal conventional screening mammogram. But yes, what we're hoping to do is, if there are any areas of concern identified on the contrast mammogram, then we can investigate those and do a biopsy of them. And if there's a cancer there, hopefully find it much earlier than it would have been found if it had been left to grow and present symptomatically. All these women have had a normal screening mammogram in the preceding months before they receive an invite. So when we read the normal screening mammogram, if we think a woman has a dense background pattern, so it's about 10% of the population who have a very dense background pattern, we flag them up to the screening office that there may be a potential recruit for the Braid study. And then our research team will send out an invite letter to the patients, and then if they're interested in attending for the supplementary screening, they can contact our research office and then be given more information and potentially be recruited into the clinical trial. We're trying to find out whether offering these supplementary screening tests is actually going to be effective. Are we going to find additional cancers? And also very importantly as well, with any screening test, we want to make sure we don't find too many false positive problems either. We don't want false positives. We don't want women coming back for additional tests and then being found not to actually have a cancer. So we don't want false positives, but also you need to make sure that we're not actually, we need to make sure we're finding additional cancers as well and making sure that it's all cost effective. So that's really what we're hoping to do. And ensure if we do find that the test is finding extra cancers and not too many false positives, then perhaps the screening program will consider introducing this type of screening test for women with dense breasts. There are other advantages as well to our patients in Nottingham too, because we already use contrast-enhanced mammography in our symptomatic service. So if you go and see your family doctor and you have a breast lump that requires investigation, you come to our clinic, then we are now able to use that test as well in our symptomatic clinic. And we've trained all our staff up, radiographers, radiographic assistants up, to perform this extra type of mammogram for some of our symptomatic women as well. So, for instance, because injecting a contrast agent requires patients to be cannulated, have a little needle put in their arm, then now our radiographic assistants, our helpers in the clinic, are trained up to do that as well. So it speeds up the whole process of delivering contrast-enhanced mammography to symptomatic women in Nottingham. So that's been a great benefit as well of the study. We've been using contrast-enhanced mammography in Nottingham since 2013 for many years, but often it was the radiologist or a doctor who had to put the cannula into the patient, which took us away from seeing other patients. So now we're able to leave the whole cannulation process to a radiographic assistant to do. it's really very similar to what happens in the CT department. So if you come for a CT in this hospital, for instance, often it will also require a contrast agent. And again, the radiographic assistants in CT will cannulate the patient, explain the procedure to the patient. And we really just adopted that sort of pathway in the breast unit. But of course, it requires training, and the staff who are involved in cannulation have to go on a course, and they have to have their competencies signed off. But they've really embraced it and say it's had tremendous benefits from delivering contrast mammography in the symptomatic service. And the staff have really enjoyed it as well, actually, and have really benefited and valued being given these extra skills. So that's been extremely beneficial, actually, for the whole team. I think with all clinical trials, it's important. We're always very grateful for people who volunteer to come and take part in our clinical trials throughout the trust. But I think this one's particularly important. Women are giving their time up to undergo these additional investigations. And to say there is great potential for benefiting the whole screening program throughout the UK. If we can show that this sort of test works and we can do it in a cost-effective manner, then it will be a great benefit to the women of screening age throughout the UK. So I'm really looking forward to seeing the results, and they should be very exciting. In Nottingham, we're aiming to recruit around 600 women to the study. We're already well on our way to that. We've recruited around 350, 360 women so far, so we're doing very well. Nationally, there'll be about 8,000 women recruited to the study, and at the moment we have around 5,500 women already recruited to the study. So it's going really, really well. And I'm very grateful for the support of women in Nottingham who've come forward to help us out with the study.